Got it. Okay. Well, we'll go ahead and start the meeting then. And it looks like we definitely have a quorum, which is great to see. And thank you all for taking time out of your busy schedule to be able to think through this to some degree. So our task per the large board meeting was to discuss pregnancy and breastfeeding with dispensaries, and how can we ensure that safety is at play here. And one of the things that been just concerned about, especially with recent data published, that 1 in 8 births in West Virginia have had substances between 2000 and 2022, which was recently published this year. And the highest percentage or the highest prevalence of substances is cannabis at almost 8%. And we know that the CDC has issued warnings regarding the risks and harms of both the mother during pregnancy and birth, and then also with the developing fetus, and then long-lasting consequences of using cannabis during pregnancy on the child into even adolescence now. And so what can we do to ensure that those risks are being communicated appropriately? And if there's anything else that we can do from a recommendation standpoint from the board. Crystal, one of the things that I wanted to ask you is that I know that per the code, there's a warning that's supposed to be in an insert with the products at the dispensary. Do you know, or can you tell us what that actually states right now? What that language is?
Well, let me pull up the insert because it will be on there faster than finding it in the rule. I meant to look for that earlier because I knew you were going to ask for that.
Oh, I should have given you a heads up. Sorry about that.
No, I should have had that ready, and it's just been a little crazy, but I'll get our insert up here and we can see what it is. That because we definitely have room to add anything, some additional information on our insert. So that shouldn't be too much of an issue, but we do have to keep that specific language. And let me share that with you. And it's also required on the warning labels for products as well. So
okay.
So this is currently what's in the insert. Are you able to see it?
I am.
Okay.
Yep. Well done.
And
So yeah, you could stop sharing if you don't mind.
okay.
So that gives a little bit. So I guess my question would be to the board members here. Do you believe that this is sufficient? Do you believe that it would be helpful to have more information? I mean, I took a look at some infographics on the internet just to see what was out there, and I'm wondering if it would be better to include something that is a little bit more substantive. I like the fact that we do have at least a blurb there, but something that's maybe a little bit more engaging, or speaking to the matter at hand for women of childbearing age, just to make sure that they understand these risks. Does anybody have opinions regarding that?
Well, Jim, I'm looking right at the NIH, and this comes from a paper called "Cannabis Use in Pregnancy and Breastfeeding: The Pharmacist's Role." I don't want to take over JJ's position here, but it basically says pregnant and breastfeeding women should abstain or minimize their cannabis use, as there is evidence that cannabis exposure during pregnancy and breastfeeding may result in cognitive, social, and motor defects in children. And I don't see that in that package insert, but I think that is not a bad place to start or to begin a discussion here.
Okay.
And I'll add to that just a little bit. Retail is my forte, right? So, people come up to the counter and, we have a lot of screening procedures for all kinds of situations. I just wonder, is there some type of screening that when someone walks into the cannabis store and they have their order from, which I'm assuming they could have got 3 months ago, is there anything that says, hey, or do you have to attest to not being pregnant if you're a woman? I can tell you that if a woman is of childbearing age in our pharmacy, anything that they get on the prescription side, our computers programs, it lights up like a Christmas tree, right? Verify they're not pregnant. You have to put overrides in and things like that. Now, I understand this is not like that, but is there at least some minimum screening tool that's used to determine if someone's pregnant or not? Or do we just sort of or are we counting on the consumer to know? So I guess there's two angles there. Do we have to make sure all consumers that can possibly be pregnant know they shouldn't use cannabis? And again, is that at the beginning of this process when they walk into the dispensary? Is there a poster there? I just don't know what's most effective. And we're not talking about patients that are pregnant that know, right? We're not talking about people that, kind of want to make the choice to use cannabis anyway. We're talking about patients that don't know it's bad and that are under some umbrella of influence that thinks that it's not harmful. So that's really where we have to fill the void.
Yeah. Rick, you were going to say something?
I just threw in there into the chat the present ACOG recommendations. There's 5 bullet points. And I think we'd be safe if we recommended that always be included. This was apparently revised in 2021. See what you think.
I also put in the clip that's from the rule, what's required for the label. But, those labels are very tiny.
Right. So, go ahead, Rick.
No, I just say clearly number 4 recommends discontinuation of use and seeking alternative methods of treatment for whatever you're being treated for. Even if we got it down to that, I think that's a little stronger than what we talked about or saw here in the first screen share.
It is a bit wordy, and I would agree with you if you could just, because nobody's going to read it. If it's already a lot of information on that initial page that was shown us, that maybe using that 4th paragraph and putting that's the American College of Obstetricians would have some usefulness.
Well, let me share my screen to show you at least one of the infographics that I was able to find. Let me share my screen here. Can you all see that? Are you able to see that? Okay, good. So here you see nice bright letters, etc. Effects of marijuana use during pregnancy, what the plant itself contains as far as the number of chemicals within the plant, pregnancy issues, 2.3 times larger risk of stillbirth, complications such as anemia, dizziness, altered judgment, breastfeeding issues that are at play regarding this. Newborn, so fetal growth restriction, low birth weight, preterm birth, increased NICU admissions, et cetera, secondhand smoke, similar to tobacco smoke harms, early school age problems for children who are born to mothers who are using during pregnancy, problems during the teenage years, both pre-adolescence and adolescence and young adulthood, things like autism, anxiety, learning behaviors, even psychotic behaviors. There's a number of studies that have shown that recently. Higher risk of using other substances, including marijuana. So this is just an example of one. And then the CDC, let's see, oh no, lost that one. Thought I had the CDC one on there too, which is a little bit more basic. I'm going to stop sharing. I can figure that out. Yeah, there we go. Stop share. All right. So do you think it's worth trying to recommend that this is something that would be included in that, or just the words such as what Rick had mentioned in the chat?
So I have a question, Dr. Berry. How out of line is it, or how, if we would recommend that there be somewhat of a minimum campaign in a dispensary that included these items for display? So like that, what you just showed there, a poster, that would be a requirement for display in a dispensary. If we would recommend sort of a minimum campaign like that, I think that would be great. I just don't know. I mean, who's really going to oppose that, right? Like, who in their right mind is going to say, you really don't want to put a color poster saying that pregnant people shouldn't utilize medicinal marijuana? Like, who's going to argue that? And I think it really does bring attention to those that may not know. So could we do something like that?
Crystal, I mean, that we could make whatever recommendation that we want to make, right? I mean, ultimately, it's going to be the actual organization that's going to do this. But we can make whatever recommendation, right, that we want to make. So one recommendation could be that every dispensary has a certain size infographic regarding, this information within its walls, so that it's readily seen, just like other, notifications, right? Any other occupational potential hazards, et cetera, which would have to be notified. Is that correct, Crystal?
Yes.
Okay.
And we could issue that as a technical advisory. We've done a few of those to clarify certain things and certain requirements. So that is something that we could do via that route.
I think that's a reasonable approach, and I think we may find out who may argue or criticize that recommendation in the near future. So it'll be an interesting process. And I suspect there will be some negotiation with regard to that, the length of that notification, but I think that's a place to start.
Okay. So if we make a motion then, or we can make a motion right now that we are recommending that dispensaries post a visible notice of the harms, such as this infographic as an example of the harms associated with cannabis during pregnancy and breastfeeding. Is there any discussion or any opposition to that?
Second.
Okay, all in favor, say aye.
Aye. Aye.
Okay, so unanimous. So Crystal, if you can help with the language, are you taking notes, or do we have somebody who can help with that language to ensure?
Yes, we're recording the meeting so we can go back and take
Perfect.
everything.
Yeah.
Um,
And so I think what I just summarized in that motion, if you could give that language back to us so that we can present that, or you're able to present that in the materials. That would be
Yeah,
helpful.
what we can do is draft the flyer for you if that's what you're wanting, and send it out to you all for your approval.
Oh, that would be great. I think that would be helpful.
Yeah, that would be great.
Okay.
Yeah. JJ, then, so that helps with some of the information. And then JJ, you raised an interesting point regarding, what kind of checks and balances are there? And so I'm curious then, in pharmacies, when all the bells and whistles light up, if it's a woman of childbearing age, do they then have to sign something acknowledging, risk, or that they're not pregnant, or, just to give us an idea of, maybe, a potential solution?
Well, in a retail setting in the pharmacy, it's a little bit more medically set up, so, I have to respond to messages in my computer in order to proceed. So, it's on me to verify that the patient isn't pregnant. It's on me to let them know that if you're of childbearing age, that here are the risks. And we can do that. We can do that by material that we give to them. We can step out and make sure that we talk to them. But the law says that anytime you get a prescription, that you have to offer counsel, and the patient has to actively decline that. So they do that at the register, at the POS system. So to ask you, do you have any questions for the pharmacist? And you say no. So, it's sort of a hodgepodge of ways to get information to the patient. I'll give you a little bit, probably more relatable situation is Suboxone, MAT treatment. We have our own policy. It's not a state rule, but we have our own policy that we will only dispense single source Subutex, single source of that product of buprenorphine if the patient is pregnant. So in that case, we require their physician to notify us that they are indeed pregnant, and then we give them the single source product until after they have their baby. So that's I know that's one side versus the other, but we're very concerned about pregnant people in the pharmacy and taking things they're not supposed to. That's like really a big focus, right, of what we do when we give them medicine. We almost assume harm from the time we start typing. So it's a little bit of a different dynamic. I don't know if that helps or not.
I think it does. It helps at least with some more color regarding, what's done currently in other contexts. Crystal, do we have an idea of how current, because in the code, and there's a warning that's supposed to be there, that the product is for medicinal use only, and that women should not consume during pregnancy or while breastfeeding, except on the advice of the practitioner who issued the certification, and in the case of breastfeeding, the infant's pediatrician. So do we have any idea of how dispensaries are currently adhering to that warning?
No, there's not any specific guidance related to that. Now with the physician certification, one of the components of the certification is that they have discussed with the patient the risk of medical cannabis use to fetuses and the risk of medical cannabis use to breastfeeding infants. But other than that, no.
Right, and it sounds like, according to the warning, technically, even if the certifying physician had certified and gave those warnings, that it's the infant's pediatrician that would have to give the okay in order for that to continue to be dispensed. per the language in the code.
I'll ask another question, and I know this probably has to be based on some nationwide information that we have, but do we have any idea what, how many pregnant people are actually getting medicinal marijuana in a facility? I mean, is there, I'm sure it's a thing, right? Do we happen to have it quantified?
We don't collect that information.
Yeah. I
So-
just kind of wondered if I guess on the 1 in 8 births and 8% of them being cannabis, it'd be nice to know that 8% being cannabis, what percentage of that is medicinal, if any. So maybe more of a preventative approach that we're taking more so than solving a current problem. I don't know.
Right.
I'm just throwing that out there.
Right. No, that's a good point. Yeah, it seems to me that if there's some way that we can ensure that dispensaries are indeed asking about pregnancy or finding out somehow about pregnancy prior to dispensing a product, and that there's some attestation that the woman acknowledges the risk, and that the physician who is certified has acknowledged the risks. And in the case of breastfeeding women, that the pediatrician itself has acknowledged the risk.
Now, how exactly would we, I can understand recommending that, but how would they get that done?
Right, and so open to suggestions, but I guess one possibility would just be an attestation statement that they have to sign that they acknowledge this and that this is the risk, but I'm not sure what else could be done.
And that would be given to who exactly, Dr. Berry? Anybody that could possibly be of childbearing age, or would that be given to every person or every woman? Like how does that work exactly?
Right, I don't know, throwing ideas, but I think, yeah, so either it could be universal.
Right.
And again, I'm not sure how it's currently functioning. Is there some universal attestation that of risk that everybody is signing, and that could this be included on that, or maybe it's already on there? I don't know. And that might be a recommendation that I suppose we could make, is to try to find out from dispensaries currently what is being done regarding acknowledge. How do you determine whether somebody is pregnant? Are you asking? And what are the potential risks? Are you getting the follow-up from the certifying physician and the pediatrician in the case of breastfeeding?
And I kind of I doubt that there is, because they don't collect medical information.
Right.
You know, I guess as long as the patient has their card, that means that a physician has certified them. The question is, did the certifying physician know they were pregnant or breastfeeding?
So Crystal, I hear you saying there's no other parameters that are being collected, whether you have chronic kidney disease or liver disease, or you have schizophrenia, and nothing. So at this point in time, there's no patterns of collections of comorbidities that may put one at risk for that kind of use. Is that correct?
Right, we do not collect any of that information. You know, the certifying physician is, you know, signs and certifies that they have reviewed the patient's medical records.
Yeah. Now I'll add this, and I think it's a good suggestion for the board. I mean, I wouldn't be scared to go into any of these dispensaries. If you haven't been in there, I have one in my town, and we had a really good employee who ended up taking a job there. So I went down there a couple times just to see him. I can tell you, it's not medical in nature. Okay. The visit is not medical in nature. I'm kind of like an outcast there. I think they probably know I'm on this board, but we're not talking pills and lab results. when we're down there. It's not that type of atmosphere. So there is not going to be any sort of didactic conversation that's going back and forth. It's certainly a place where we can forward them information and require that. But there is no, and I don't want to use this word wrong, but there's no intelligent conversation about somebody's healthcare needs. It's not happening. It's not happening. And by law, it doesn't have to, right? So I just wanted to throw that out there.
My experience in the one here in Warwood in northern West Virginia, it's a retail event. And I would agree, there's little communication, but I think there is some responsibility, particularly with the pregnancy and breastfeeding standpoint, that I think we have to make that recommendation. But the issue of industry and retail is really seems to be the focus of the dispensary. And I guess that's okay.
Yeah, I'm all about making the recommendation, and then I guess it would be up to the medical cannabis board to sort of implement something that's practical, that sort of rises to the level of completing the recommendation. And I think posters and handouts might be the limit there. I don't know that having anybody sign anything might not fit into their model. I'm just not sure.
Yeah, very good information in trying to think through this. Because at the same time, right, even though, and I would agree with both of you gentlemen in the sense, at least here in my county, just with the advertising that's out there, it's, basically a retail enterprise. But at the same time, this is also within the public health spectrum, that we have a responsibility to try to ensure public health. And certainly this is medical cannabis is by definition of what the state's determined to do. And so we should, as much as possible, be able to help shape what is being done and exchange of information within these dispensaries that would be most in line and in keeping then with other medical pharmacies and other medical enterprises, so that risks and benefits are acknowledged and heard, and we get the appropriate education. So with that said, what is the will here as far as the possibility of making another potential motion that would take a step further to require a dispensary to check off a box, or a patient to check off a box that acknowledges these risks and has received this education? Is that something worth exploring now? Is that something worth considering at another date, or is there more information that we would want to gather to be able to do that?
I think, Jim, it's a great idea. However, you're going to have someone who is a non-medical individual asking someone about a medical condition. You start to get into HIPAA and all that nonsense, but we could recommend that the doctor has to document that, who certifies that particular medical cannabis user. Because as you know, it's highly unlikely that Greenleaf's doctors, whoever they may be, even care what comorbidities there might be. They're there for a different purpose, and that's to certify as many patients as they can, in my opinion.
Crystal, go ahead, JJ. I'm sorry.
Well, let's just take that a step further, and let's assume that's not their narrative. Let's assume that their narrative is to properly qualify patients.
Yeah.
What is the requirement? I apologize, I don't know. What is the requirement to get recertified? Is it once a year? I only have to get recertified once a year?
It's once a year. Yep.
So I don't know if there's something we can do with that, with someone who's of childbearing age. I mean, there should be I mean, there's nothing wrong with certifying them that they're not pregnant more often than just once a year. We certainly wouldn't do that in any other medical setting where you were in charge of somebody's care. So I don't know if we can, make a recommendation that those doctors that are certifying patients, that they have to verify they're not pregnant more often than just once a year. That's how you would have to do it if you did it on their end. Certainly, they're saying on the front end they're not pregnant, right? I mean, I would hope so. But after that, they're not even worried about that patient, or they don't have any responsibility to that patient for 1 year.
And let me clarify, it does not say that they have to be recertified. That was our interpretation, that they require continuing care. So since they have to renew their card annually, we require the annual recertification. But it does not specify what the continuing care is, because that's left up to the physician.
So we maybe could make a recommendation that the continuing care would include certifying the patient isn't pregnant at least every 90 days or something like that. I don't know. Like I said, if it's not a problem that we're trying to fix and it's more of a problem we're trying to prevent, maybe that's not appropriate. I don't know.
And Crystal, what is on the certifying form that a physician fills out? What is listed in there regarding pregnancy currently? Do you know?
Just what I read to you earlier, about the risk of medical cannabis use to fetuses and to breastfeeding infants.
And that's on the actual certifying form that the.
Yes.
Okay, I guess I missed that point earlier. Okay.
So Dr. Berry, what are you thinking as far as an additional recommendation? Do you have something in mind of where you're?
I mean,
like,
the thing that I had in mind was just, that possibility of, again, having some sort of attestation form that at the dispensaries, there's an acknowledgement that the woman is saying she's either pregnant or not pregnant, and acknowledges that she's been educated regarding the risk. But that was the only other thing that I had in mind.
Well, I think that can be done in a sort of one directional way, right? That if they're so from the time they're eligible to the program up until the time, if they're 50 or something like that, they would have to sign that attestation. I mean, that really wouldn't require any explanation from the provider, other than this is an attestation that you have to sign, read and understand.
Right.
And then if there were any questions that patient would have, if we're allowed to call them patients in that setting, then they would be referred to their certifying physician.
Yeah, does that seem reasonable to everyone else?
I think it's a reasonable recommendation, but you're talking about a guy who has 50 pieces of paper every time I sneeze. So,
right.
so it really is a reasonable thing to expect when you go to get something medicinal like that.
Yeah, and it seems like it's the least burdensome way to go about this.
Right. Well, I would gladly make a motion that we recommend there be some type of attestation to childbearing age patients, women patients, to make sure that they are aware of the risks from their provider or their certifying physician.
I think that's a good motion. Is there a second to that?
Second.
Okay. And any discussion? All in favor?
Aye.
Aye. Very good. Okay. So that will be our second motion then. Oh, go ahead. Was that an aye?
That was an aye. I'm sorry. I'm listening, but I had another person in my office, so
Yeah, no,
sorry
fair,
about
fair
that.
enough. Thank you for that. I appreciate it. All right, so we've got two recommendations then that are unanimous coming out of our medical work group. Anything else that folks wanted to discuss here? Seeing none. At this point, Crystal, are there any other public folks with comments or?
No,
Okay,
nobody else on here from the public.
okay. I didn't think so, but I wanted to make sure before we finished. All right, with that, we will go ahead and complete the business of our subgroup. And thank you, everyone, for being able to participate and, again, taking time out of your busy schedules to do this. And hopefully we'll see you all at the next full board meeting, which is next week, right, Crystal?
Yes,
Thursday.
yes.
Okay. All right. Thank you. Have a wonderful day.
Thanks, Dr. Berry.
Jennifer.